For my presentation, I'm going to talk about nursing image. My name is Vincent Diller. The objectives of this presentation is to summarize the importance of nursing image and to understand how healthcare is affected by nursing image and learn about nursing image's impact on society. First, we're going to talk about the importance of an image. The image is a way people or a profession appears to society and other professions. It is the face, like what is the face of nursing? And the impact of an image is profound. Finkelman and Kenner stated that the importance of the image is used in recruiting students or public view, for funding for research and education, relationships with healthcare leaders, administrators, relationship with government agencies and legislators, and also our self-identity. Self-identity is large, or is huge in for a nursing image, and that patients usually have a positive interaction with nurses, but they don't necessarily understand or see the whole picture of nursing. The Gallup poll in 2017, it was the 16th year straight for nursing to win as the most honest and ethical profession. 16th year straight. Now that is something that nurses that we should celebrate with. The influences on nursing image. As I stated before, self-identity. Self-identity is huge. It's how we talk about ourselves and how we talk about our own profession. Do we celebrate what we do every day, or do we complain about with our friends and family? Does our complaining nullify our compassionate care? And are we putting on a fake face in front of people to appear and act a certain way to improve patient satisfaction? We need to change how we view our own profession and work before society and before other people see a difference in nursing. Another influence is media, whether it's advertising, TV, movies. Media shows the caring side, but it neglects the knowledge and the competency we have as nurses. Here is an image to the right. This advertisement that was probably in the 40s or 50s. Now this advertisement isn't really relevant today, and it wouldn't be used as an advertisement today, but that was the face of nursing back then. And the government also influences nursing image. The Nursing Week in May, the Congressional Nursing Caucus in 2015 supported a campaign called Nurses, Their Vital Role in Transforming Healthcare, and it highlighted that nurses are the backbone of healthcare. And what's missing from our nursing image? One main thing that is missing is our knowledge and clinical competency. Society knows that we care and are compassionate, but it does not understand the knowledge nor the competency that nurses have. And I think that many of us can relate to this, that our friends and family really have no clue what we do as nurses. And I'll talk about why it's important in slides to come. And the benefits to healthcare and nurses. One thing is changes in healthcare policies. With nursing, we are on the front lines of healthcare, and we should have a voice in the healthcare policies. And also changes in hospital policies. Tomagen in 2012 talked about advocacy and how nurses should advocate for what we do and the policies that we act upon. Nurses are usually the forerunners of implementing evidence-based practice. And also it changes in wage. Spetz and Bates in 2013 talked about that if a bachelor's is required, then nurses should be paid more. If they are seen as more professional, then that should also be matched with a pay raise. Next, the impact on society with our nursing image. That more nurses are compassionate and clinically competent means improved care all around. And most importantly, improving a patient's trust. And that patients usually have positive interaction with the nurses, but they meet so many people in the hospital that it may be difficult for them to differentiate who is who. A report by West and Associates talked about that contributing to quality patient experience, applying evidence-based practice to support changes in nursing dress code. That if nursing follows through with their professionalism, they should wear clothes that match that. That they shouldn't walk around in the scrubs like they used to with goofy and cartoon characters on it. At least if you're not on the peds floor. And also less stereotypes. Cohen expressed the need for less and less sexual stereotypes of nursing, and which would lead to more professional encounters with our patients, which I think is something that we need to strive for. To summarize, nursing image and professionalism is important. Our image is important not only to us, but also to healthcare as a whole. The majority of workers in healthcare are nurses, and nurses should want control over our own image. We should know that we have the capabilities and the power to improve our image. And here are the references. Thank you for listening.